Welcome back to another episode of In the Nick of Time. We are joined by a absolute rock star, Mama Nurse Tina. She has 1.5 million followers combined across all social media platforms. My sisters follow her. My wife follows her. I follow her. I'm going to meet her in Vegas in a few weeks. I'm really excited about it. Thank you so much for making the time, Nurse Tina Betancourt.
Yes, you did it. You got it.
Got
It's a
it.
it's a Filipino last name. My husband's a Filipino, so everyone usually butchers it. It's good. Yeah. I go by Mama Tina. You're great. You did wonderful.
That was the brown in me coming out. So
Wonderful. It's like we're synced.
yes,
It's good.
yes. So we're synced, absolutely synced.
Yes. How are you?
I'm fantastic. I have so much to ask you because I went through your Instagram profile. I absolutely love it. There's so much educational content on there, and you myth bust so many things that even I, as an anesthesiologist that plays epidurals, did not know about. So I'm really excited to ask you so many questions. But before we start, please tell me where this podcast finds you.
This podcast finds me in Edmonton, Alberta, Canada. I'm a Canadian, but so many of my friends online are from the US. Which brings me joy because I think that there's a really big need for bringing that education to maybe people who can't access it otherwise. That's what you probably love about social media as well, is that you can sort of make it equitable for everybody, and everybody can find what they need online, regardless of where they're coming from and broadcasting from and all of that. So that's what I love about it.
Yeah, I'll say it. Social media has opened up so many new doors and new friends
Yeah,
that I never thought I would have.
it's
Just like
really
connecting
cool.
with cool people like you online and
Yeah.
people with the same like energy that you do, and it's awesome. It's such a unique experience.
It is really cool, and I always say too, I'll follow somebody online, and then I'll meet them in real life, and it feels like Love Is Blind. I'm always like, it's your it's your face and your voice, but now you're in front of me. It's so wild.
And you feel like you've known that person for such a
Yeah,
long time, and you're like, wow,
totally. Yeah.
I know you.
Yeah, I'm blessed to say that, like, 3 of my best friends now in the entire world came from connections on social media, which is unreal because 'cause you're like, "I'm 43," so you think, like, "I have enough friends at 43?" And then you
Yeah,
meet these beautiful souls, and you're like, "Oh my god, like, where were you my whole life?"
yeah,
So it's
yeah.
been really cool.
I echo that sentiment. I've made better
Mhm.
friends through social media than I probably did growing up in real
Totally.
life.
It's probably because like, that passion and that interest is there, right? And you're like, "Yes, like, we are the same. We're the same people."
Yeah, absolutely. I did some digging on you, Tina, and I found that you were an ER nurse
I
before
was.
you
Mhm.
shifted over into the
Mhm.
world of
Yep.
OB. Can you tell us a little bit about
Started from
your?
the bottom, now we're on top. Which is true. At my hospital, the ER is in, like, the basement, and so the 3rd floor is labor. Yeah, it's good.
Well, in the US, we do consider ER to be not at the top, I guess,
Mm,
in the
mhm.
hierarchy. So
Mhm.
there are some unique opinions on the ER. So tell me a little bit about
Yep.
that journey. How did you shift from ER to OB?
Yeah.
What made you change?
I'm a bit of a bit of an adrenaline junkie. So in, like, nursing school, I had said I either wanna do emergency medicine, like, not medicine. I mean, I did wanna be a doctor at first, but I kind of flunked out of, like, the organic chemistry, and I was like, "This is not for me." And I either wanted emergency nursing or I wanted labor and delivery. I ended up getting a really great opportunity in emergency. It was like a grad nurse initiative, which is like, oh, it's so good because you're just mentored so much more than people are now. And so I went that route, and it was great. I think it's an incredible place to learn skills and general assessments, your head to toes, like being able to identify things that are really, really important. It just became, as time went on, it was, like, abusive. The ratios of patients to staff became worse and worse. We had people in, like, the hallways that were being cared for, like, 7 days at a time, and I was like, "This is not it for me. Like, this is just not it for me." And then I found that, anybody who came in having a baby into emergency, most people run away from it. Emergency nurses don't love babies coming out of people. I was, like, running to it. I was like, get me in there," and I was, like, super excited, and so I said, "That's the next step for me." I did ICU for a bit too. That was not for me. It was not the jam. It's not it. I did it for a year. I was like, "That's good. That's enough." It's very, like, intellectually stimulating, but for me, it just was not a mix. So, anyway, and then I ended up in labor and delivery, and I am absolutely head over heels in love with it still.
Yeah, I would say labor and delivery is a whole
Oh
different beast than the ER.
my god.
I so they've been I so I this is gonna lead me to a question that
Mhm.
wasn't intending to ask you, but I
Mm.
hear it all the time. So we're in Pittsburgh now, and the
Yep.
Pit is filmed here at Allegheny General Hospital.
Can I just
And
say, Noah Wiley has aged like a fine wine. Oh my god, I was in love with him in 2007, and I'm more in love with him in 2025. Oh, love you.
that's
Noah, if you're watching, I see
Noah,
you.
yeah, we hopefully Noah's there at the health conference.
Right? Oh my
But
god, I would die.
Yeah, it would be really cool to meet him. He's here a
Mhm.
lot. He's at the children's hospital and stuff, but unfortunately, I
Which is
work at
lovely.
the rival hospital, so I don't get to see him ever.
You're actually on his X list. He's like,
Yeah,
"Nope, that's not you're not."
I think we're on the yeah,
Did you
not
get a
paid.
sweatshirt? Did you get a Pitt sweatshirt?
I
See,
didn't get
that's
anything,
why.
yeah.
You're at the
You
rival
did
hospital.
they gave him out.
Yeah, so I saw some people unboxing them. I did
Yeah,
not
I
get
saw
one.
that he came to the, Figs thing too, and I was like, "Oh, man, I
Yeah,
would have loved to meet him at the."
yeah, absolutely. I think
Did
it's
you go?
amazing what he's doing. No, no, I was
Okay.
not with Figs at
Was
the
that like
time.
a, congressional thing? They were getting
I think
different
they
co
were yeah, they were pushing, I think, for better ratios, better like, just better overall, like, yeah, conditions for healthcare
right, right.
workers, which I
Yeah, it'd be cool
love
to
that he
meet
does
yeah,
that. Wow, that was
yeah.
a tangent. Hey,
Yeah,
Pitt,
that is
we love
totally
you. We love
yeah.
you, Pitt.
No, we love you. Come on the
Call
podcast.
us.
No.
Call us.
So why did I oh, yeah, that's, so I hear all the time that it's unique to me to hear from you that the same kind of environment in the
Mhm,
ER is present in Canada as it is in the
mhm.
United States, and I hear a lot of times that, "Oh, I wish we had Canadian healthcare," and I don't think
Mm.
anybody really talks about the
Nope.
positives or sorry, the negatives of Canadian healthcare. Can
Mhm.
you shine some light, being in
Yes.
the ER and shining and being in a Canadian healthcare system? What's the
Let me
differences? Is it better? Is it worse?
Yeah, let me tell you about it. So it's better in that, I mean, anybody can access care without worrying about being bankrupt. Like, when I hear about, like, the hospital bills people are walking, I'm like, how is this a manageable thing? Like, how is it ethical to, like, have somebody decide between getting care and, like, being bankrupt or not getting care and, like, possibly, like, dying? You know what I mean? Like, that to me is worst case. So I can tell you this, I worked in Los Angeles, actually, like, Culver City. I did a
Yeah,
travel nursing contract, and it
did
was
you?
very, very eye-opening because we like, first of all, they said, "Okay, you charge for everything," and I said, "What?" And they're like, "Yeah, every item of equipment you use, you put a little sticker on a sheet," and I said, "Oh my god." So I would, like, miss an IV, and I would feel terrible because 'cause I'm like, "Oh my god, I'm supposed to charge them extra because I missed." Anyway, so I would, like, sort of put the sticker, it would just go in the because I was like, "This is crazy." And so then they would say, "Okay, when you check out, here's your bill." And it was like $1,000 when you just saw a doctor, got triaged, had a set of vitals, and went home. And I was like, how how are people doing this? So but what was also interesting is that people would be very upset when they had to wait a long time. And it was interesting coming from me because, like I said, we'll have people in the hallway waiting on an admission bed for like 5, 6, 7 days, right? And they're having all their nursing care done in the hallway. Like, you have people using bedpans behind a curtain in a hallway. And I'm like, it's so awful. My husband still works there. He's actually doing a little bit of sports medicine stuff now because I mean, he's trying to phase out. He's 50. He's like, I've had enough. But yeah, like the staff patient ratios are awful. We just continually are taking over bigger and bigger areas of the hospital because there's just not enough room for people to get in and be seen. And then you will have, I don't even know, like 40 people in the emergency department that are admitted to different specialties and they're waiting on beds. And so they're staying in their beds for this prolonged period of time, waiting for a bed upstairs, which is not available. And then people can't get into Emerge to be seen because there's nowhere to see them. So sometimes you have doctors seeing people in the waiting room, which is its own liability in itself, right? If they were sick enough for you to see them in the waiting room, why weren't they sick enough to get into the bed? There's a lot of issues with Canadian healthcare. The one nice thing though is that if you come in and you desperately need care, you're going to get the care regardless of your insurance policy, regardless of your age, your race, your gender, your socioeconomic status, you will get it. It's just, I think it's like the midliers, the people that are admitted to family medicine, internal medicine, like they really see the deficits of our healthcare system because they're just sitting, waiting. They're waiting.
Yeah.
Yeah.
Well, so tell me a little bit about the malpractice side of it, because for the
Mhm.
US, it's very protective
I
medicine. You
did
just
notice
cover
that.
yeah, you cover your ass
Mhm.
for everything. You just order an
Mhm.
X-ray, CT scan.
Yep.
Anybody comes in
Yep.
with chest pain, they get the full
Mhm.
cardiac workup. It's
Yep.
just, it's very different. Is it the same in Canada or is it
It's
different?
it's not. No, so I found that interesting too. The first time somebody left and I saw the doctor call them, like, personally call them, be like, "Hey, you were here and you left. How come you left?" Like, I was like, "What?" Like, I mean, people leave all of the time. They'll come in, they'll wait in the waiting room for, like, 6 hours, and then they're like, "I'm out of here. Like, this is ridiculous." And they just sign, like, an AMA form, and they're gone. There's no like, we might say to them, like, I always say, "If you're sick enough to think that you need to come in and see us, then you should probably stay and get care." But I mean, it's so frustrating to be not only are you sitting and waiting for, like, 6 hours in a waiting room, but you're sitting feeling like garbage in a waiting room for 6 hours. It's like it's different than if you just felt well and you were waiting. It's annoying. But, like, to be in pain or to be feeling with a fever, feeling sick and waiting and waiting and waiting, it's really, really awful. And so, yeah, people leave all the time. All the time. They come in and they leave, and it's like, "Oh, okay, super. Well, you left." Like, I can't really do anything about it. So, yeah, it's unfortunate. The thing I used to say about emergency medicine is that people come in and they truly believe that their emergency is an emergency, and to them, it probably is an emergency. And so I think there are some people I've seen it online where people sort of poo-poo on people leaving. They're like, "Yeah, you left." But it's like, we have to remember that everyone comes from different backgrounds, and that is an emergency to them. Like, that moment is maybe the worst thing that's ever happened to them. We know it's not really a true emergency because we see, like, big emergencies, but to them, it's stressful and it's an emergency, and it's important to them to be seen. So I understand the frustration when they're like, "This is a serious thing. Why am I not being seen?" It's interesting.
Yeah, it is very interesting. It's a little bit
Mhm.
different, from our
Mhm.
perspective here, but, at least a lot of the motifs carry through, I guess, from
Totally. Is
all over the world.
malpractice insurance, like, astronomical in the States for
It's
doctors?
insane. Absolutely insane. I mean, for
Whee!
OBs, I think it's the highest of any profession.
They are the highest litigated, I've heard that.
Yeah,
Yeah.
they pay, I think, between 20 and $40,000 a year for
Oh
their
my god.
malpractice
And you know
insurance.
what? It makes sense to me that that would be a highly litigated area because it's like your baby is like your soul, right? Like an extension of your soul. And so I think if something happens to you as a person, I mean, that's devastating. But if something happens that you think is preventable that happens to your baby, like they're fresh, like they're just like this new, like fresh blank slate. And yeah, I can see how it could be highly litigated.
Well, there's also this, there's this tort or condition that you can essentially sue an OB up to 18 years old. So if the
Right?
kid yeah, so if they have some deficit, I don't know, 12 years later, you can go back to your birth and say, "Oh, you messed this up or you
Oh
messed
my
that up." And
goodness.
so it's,
Which just, speaks to, nurses out there to chart well, chart thoroughly and chart well. Because 'cause I'm telling you, like, you could go even 1 year and I'd be like, I don't remember that case."
yeah,
And they're
I can
like,
go
"Is
3
this you?
days.
Dis you? Did you write this?" "I did write that. It says my name on it." Chart well, follow the
Yeah.
rules.
Well, that's hopefully where AI will help us all out, hopefully. But
My
we'll get to that.
goodness.
I have a couple
It's gonna
questions
be
for you about
wild.
AI and how it affects, but let's get to the meat of this
Go
discussion
ahead.
why
Yeah.
I'm so excited to talk to you about the OB stuff. I
Mhm.
wanna start off just to give everybody a little bit of background. You built up a amazing following, just very loyal followers.
Mhm.
When you pivoted to OB and becoming a social media influencer, was there a specific story that kind of you wanted to share? Was there a kind of a underlying theme that you were like, "I really need to get this out or off my chest?" What made you kind
Yeah.
of, inspired you to do this?
It's interesting, I think, how our journeys sort of, like, transpire as the years go on, but, like, I just wanted people to know that, like, come as you are, and we are here to help you. Like, there's so many things that people in my time in practice, people apologize for. People apologize for so many things, and I was like, "I wish you knew how little we care about this stuff." And so it was like, "Ah, well, I'm gonna tell people how little they care," or I'm gonna tell people, like, "These are the 3 things." The thing that I see a lot of people miss is, like, opportunities to take photos, gather memories. Like, I look back at my childbirths, I've had 4 of them, and there's so many things I wish I had on video or in a picture, and so I'm like, "Hey, I'm gonna tell people these 3 things, don't miss these moments," and those types of things just went viral, and you're like, "Oh my
Yeah,
god, this is a missing piece," and I think that there's a ton more, like, labor and delivery creators out there now, which is really, really cool to see, because I think that there's, like, this awareness that, like, "Oh my gosh, people that have not had a baby before, have not been in hospital before, there's just like a real lack of knowledge, not only of educational information, that's really important, but I think also of those everyday moments, like, that are real life applicable. And so I think stuff like that, like, don't forget these pictures, make sure you put this in your hospital bag. Those are things that, oh, like, I didn't think about that because I've never had a baby. I
yeah,
I remember being at my sister's induction before I worked in labor and delivery. I thought she was just gonna, I don't know, maybe get some sort of a pill and then, like, crack a baby out, and so I booked a flight to Australia that evening, thinking I would just meet my niece and we'd be good, and I was like, "Oh, like, this takes a long time," and my sister's like, "Oh, this takes a long time." Like, no one you didn't know anything. And I
yeah,
think I don't know what it's like there, but here a lot of times your OB appointments can be like boom, 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 like they're very rushed. And
right.
so I think a lot of those little nuances get missed. And so I think that's where it's really nice on the patient side of things. it's awesome. I see OBs educating about very like educational, information rich stuff. And I think it's so good. But I love that there's like the nursing side of things to be like, hey, these are important things, like from a more of a personal, like, yeah, like little nuanced side of things.
I'll be honest with you, I enjoy your type of content way more than I enjoy the educational
Don't
OB
tell them
content.
that.
I say it all. I mean, it's nice and it's fun to hear about all the cervix dilating and all that stuff, but, and this leads me exactly to my first question for you. So labor plans,
Mhm.
I have a little bit of mixed feelings about it as an
Mhm.
anesthesiologist.
I bet you would.
Can you, 1, tell me what's a non-negotiable that everybody should have in their labor plan? And 2, what's your approach now being seasoned
Mhm.
as a influencer, but also as an OB nurse? What are some things that you would recommend people think about for their labor plans?
Yeah. I think a non-negotiable is like communication. I think that there's varying degrees of it and people love varying degrees of it. Some people like want to know very minimal, but I know for a lot of people, just bringing up the fact that communication is important to you can really go a long way in reducing birth trauma. And I'm super passionate about birth trauma. I think it's something that's overlooked because people think that there has to be this big catastrophic event to walk away feeling a certain kind of way about your birth. It's really not the case. It can be as simple as like I felt like things were being done to me instead of with me. And so I think bringing up like how you like to be communicated with, if you like somebody to be speaking quietly to you, if you like a lot of information because you're a type A and you want to know all the things, like sort of specifying that can really go a long way. And not, I mean, this should be a given. This shouldn't need to be on a birth plan. And it, I mean, technically doesn't. But I mean, if it's there and the staff reads it, sometimes that's like a little reminder. Sometimes I think as medical people, we get into the thing where it's we do this all of the time and we forget that there's a person attached to it that hasn't done it all of the time. And so I think just being reading it and being like, "Oh, like yes, like this is your first time. This is your only moment with your birth experience. You cannot redo this. Like I'm going to see this again probably 3 hours from now and then the next 3 days in a row." So I think that that's something that you should think about how you like to be communicated with and just pop it on there. It's really, I don't know, I think it's a nice reminder for everybody in the room that communication matters. I tell you what I don't love on a birth plan is that I want to live. I've seen some people on social media, they're like, "Here's my birth plan, live and then eat sushi." And I was like, "That's really funny." But like I always say like healthy mom, healthy baby is the low hanging fruit. Like it's the lowest bar that we could possibly
Baseline.
provide you with. Yes, we want you to live. Yes, we want your baby to live, but there's so much more that goes into it. So you can put that on there. I will laugh at it. But I'm like, there are some really important things to go on there. And I think, yeah, communication is really important. And then there are some things that I think are important to talk to your provider about beforehand because a lot of these should be standard of practice. Things like delayed cord clamping, skin to skin immediately afterwards, those should be standards of care. But I think sometimes I'm learning that maybe they're not. So it's probably a good idea to put them on there if you want them.
Yeah.
Mhm.
I love that. I have never actually thought about it in that way, that this is maybe the first time they're having a baby or
Yeah.
first time they're having going inducing labor, you know? Maybe
Mhm.
last time they were rushed straight to a C-section. This is the first time
Right.
they're going through the process of how do you like to be communicated, especially because in OB, you have a relationship with your patient for almost 72 hours, sometimes like 4 or 5 days.
Mhm.
So you're in the labor and delivery ward and you get to know somebody and to make them comfortable in their mode of communication probably eases a lot of the anxiety that comes along with labor. And I actually love that answer. That's
Mhm.
awesome. I will use that anytime I, place an epidural going forward.
There you go. Also, I will say this, I want people to know that they can request another nurse. Some people call this firing the nurse, which I mean, I don't love because 'cause I'm a nurse, but, like, because let's be real, like, no 2 personalities are gonna mesh 100% of the time. Like, there's always going to be people in the world that you just don't vibe with. This comes down to communication. You might have a nurse that's, like, super go get 'em, woo, like, and they blow in at, like, 7 o'clock in the morning, and they're like, "Hey, mama, we're gonna," and some people love it, and then some people are like, "That is like nails on a chalkboard for me. I cannot." And so sometimes I think you can mention it to them, but sometimes, maybe mentioning that to the charge nurse that you might need a different personality is more than fine. And I can guarantee you this, we can feel it. We can feel it when it's not a vibe, and you can try your best to make it a vibe, but this is your one opportunity with this one baby, and, like, we want you to get it right. And so I personally would never be offended if someone was like, "Nah, like, it's just not a match." And this happens a lot. We try to pair people up in good matches, like, with moms and nurses. Like, they give
Interesting.
Yeah, they give me a lot of people who want, lots of like, spinning babies type moves, and they don't want an epidural or whatever because they know that I love that stuff. And so for me, it's a match. But there are nurses that like they hate that stuff. Maybe they've been doing it forever and they're just not into it. But there are people out there that want like they don't want any of that stuff. They just want to come in and have their baby and be unbothered, and that's fine too. And so I think it's good to people know that it's not always going to be a match, and that's okay because we would never expect it to always be a match, and you absolutely can ask for another nurse. That's okay.
Yeah, no, that's actually is that standard? Do a lot of OB practices across the country, I guess, or even in the US, did they try to match nurses with patients, or is it kind of unique
I
to
think
your hospital?
it's probably site specific, but I mean, like, it would make the most sense, and sometimes if I have a patient that I know likes a certain type of personality, I might come out and look at the board and be like, "You know what, Charge? Like, this person is probably gonna be a really good match for this person." Because, like, you just want the vibe to keep going. Like, if you finally have gotten to a place where it's going well and they feel comfortable, and this happens too, you're like, "Okay, my shift is over in, like, half an hour." They're like, "Oh my god, don't go." And you're like, and we feel the same way because it's like you've gotten into this vibe, and which is the best case scenario for them to keep their labor moving forward. So I do like people to know that if it's not a vibe, that's okay. Like don't feel bad. This is your one chance. I try to like drive that home. You cannot redo this. And I've heard people say like, this nurse was good, but I wish I had a different nurse for postpartum, or I wish I had a different night nurse. And it's like, I don't ever want you to say, I wish I coulda, shoulda, woulda. Like get it. It's your one chance. Just, it's okay. It's your one chance. And you'll never have to see them again. So it's fine.
Well, the idea of firing a nurse, some people in today's society, there's this mixed opinions. People are scared to say, "I
Yeah,
don't want you, I don't choose you,
it's hard.
I deserve somebody different," or whatever it is, and that's mustering that courage or hearing that from you probably
Hmm.
as kind of being a spokesperson for that. That'll probably change a lot of opinions, I think.
I hope so, because it's a hard thing, right? And we talked about this a lot too. Advocating for yourself is hard in general. Advocating for yourself when you are the person in the most vulnerable spot in the room with somebody who's in a position of power is probably one of the hardest things in the world. That's why having a supportive person with you who maybe isn't in a vulnerable spot that is feels okay to speak up is a really, really important thing in labor because it's hard. You can be even myself, like I'm a pretty loud human, but I mean, when you're in this situation and maybe maybe you're transitioning, maybe you're feeling not well, you're going through pain, maybe you're concerned about baby because they're saying we're seeing dips in baby's heart rate and multiple people are coming at you. You want to advocate for yourself. You know that you can and you should advocate for yourself, but sometimes in those moments it's like a mute button because it's hard to do those things in those stressful, vulnerable moments. So I think that's also where having a good connection with your nurse is really important because they can be that megaphone for you when you need it.
Yeah. And that's very interesting that you said it that way. I was the next question that I have. As an anesthesiologist, I get to come into the OB ward and kind of
Mhm.
see different personalities and different parts of the labor process and who does what. And I think a lot of the times OB nurses are not given the credit for the amount of time, effort, and involvement they have in the birthing process. And I think a lot of people listening would be actually shocked to know that the people who are monitoring the fetal heart rate most of the time are the OB nurses. The OB now the credit tends to go to the OBs, but
Mhm.
I think that OB nurses, for the most part, are not really advocated for, or at least recognized for their involvement in the process of the childbirth. Can you talk a little bit about what is the role of an OB nurse, especially in that, 6-12 hours leading up to baby coming
Mhm.
out?
Yeah,
Normally or
people are surprised to know that that doctor's probably gonna roll in, catch the baby, and be like, "Here you go." And they're like, "Aren't they gonna be?" You're like, "No, I'm gonna get you to the point where, like, this much of your baby's head is showing, and then I'm gonna call them in there, and I hope that I call them at the right time. I don't wanna call them too early, but I don't wanna call them too late," right? That said, like, people are like, "Oh, don't you wanna would you wanna be an OB?" And I'm like, "No, I wouldn't." Because, like, to me, that's an incredible amount of pressure. Like, when we break it down, OB nurses, we are basically bringing you in. We're letting your obstetrician or your midwife know that you are here. This is how you're doing. What's the plan? We're getting the plan started. So sometimes that'll be, getting your IV in place if you're there for an oxytocin induction, or we're getting you situated to the room. We're telling you where everything is. We're doing all the things. We're taking the health history, all that stuff. And then as things go on, we are then communicating with your provider as to what is happening. So if we're seeing things that are concerning, we're calling them and we're letting them know, or we're saying, I need you to look at this strip, or we're sort of directing things. The reason I wouldn't want to be an OB is because that's shit ton of pressure, in my opinion, to be like, oh, okay, I'm just going to say what's going to happen to two different people, and that's going to be on me. That's too much pressure for me. I don't enjoy that. And so in those reasons, I'm like very appreciative that there is somebody that I'm calling to be like, hey, I'm concerned about this. So it's a huge team dynamic, I think, in obstetrics. A lot of nurses are a little bit stunned if they come from a different area, maybe like med surg, the amount of autonomy that they have as a nurse in obstetrics, because you sort of just do. You're like, oh, their pressure's low. I'm going to give them a bolus. I'm going to let them know. I'm going to give them ephedrine because you guys have left us standing orders to do that, whatever it may be. That is like unheard of in other units of the hospital. Like you have to phone and be like, "Hey, their blood pressure's low. Can I can I give them, 250 mils of fluid?" So they have a fever, can I give them Tylenol? Like these are just things that we will do because it's sort of expected of us to be able to do these things. I would not want to be an OB because that's just so much pressure. Again, on two different people, like a two-in-one, a twofer deal. And again, in a period of time where it's like so, so important to get it right. So I'm like, kudos to you. That's too much stress for me. So while I love like getting them to the point of calling in the OB, I don't know if I'd want to be the one on the other end of the phone because we'll be watching a strip and being like, it still looks bad. Hey, I'm calling you again. It looks bad. Like, I don't know if I'd want to be on the receiving end of that call. That's a lot of pressure. Kudos to you
Yeah.
guys.
I'll be honest with you. I actually think your job is more enjoyable than the OB's
What's
job.
Yes, it is
Making
very enjoyable.
relationships with those,
Yeah.
those patients and the
Yeah.
1 to 2, and it's like you get
Yeah.
to be a part of that amazing experience that,
Hmm.
everybody looks
I
forward
love
to,
it. I
even
love
if
it.
first time, second time, third time, everybody looks that
Hmm.
there is no part of there's no surgery still to this day that gives me chills the way when you hear the first
Oh.
cry from the baby in the operating room or when they come out naturally
Mhm.
and the
Mhm.
mom cries and the dad cries and then I just get teary. I'm like, "Oh, man." Every time.
Sometimes,
I even get goosebumps
yeah.
thinking about it right
Sometimes I still forget what I'm supposed to be doing in those moments. Like, I watch a baby come out and I'm like, "Are you aware of what's happening down?" Like, it's still you it's like 1 sperm, 1 egg met, like, made it to implantation, grew a human, that human is coming out of you. A whole person is and so they'll be like, "Tina, did you push the?" Because we often give, like, oxytocin as the baby comes out,
Yeah,
like, "Did you give that?" I was like,
yeah.
"Oh, no, I didn't. I was so in I'll give it after." It's yeah, because it's still like, you see it and you're like, "How is this happening?" It's unbelievable. Yeah.
Yeah. It's
So
actually the same for
it's a
me.
great job.
When the baby comes out, I always just take a second
Oh,
just to take it in because it's such a, like, it's a new life coming into the world, and it's all there OB's like, "Did you start the Pitocin?" I'm like, "Oh, yeah, yeah, we'll
yeah, you're
start it
like,
right
"Oh,
now."
oh,
Just
yeah, yes."
let me just
Yeah,
absorb this for a second. This is awesome. This is a
it's
miracle of life
so
happening.
cool. There was a sound on a TikTok that I wanted to use. It was like, look at this," and they're like, "I already seen that," and then they're like, they, like, punch him in the because I'm like, I don't care if you've seen it 100 times, it's so cool. It's just such a cool
Yeah.
thing. So, yeah,
It is
that's why
literally
I
the only
love it.
part of
That's why I
medicine
love
that
it.
yeah, it's the only part of medicine I still enjoy. Now, this is you said Tylenol, and I don't know if you've been
Boy.
keeping up with the news, but in the United States, Tylenol is a hot button issue.
Mhm.
How are they treating Tylenol in Canada right now with everything going?
It's, yeah, I haven't heard anything too much different. I haven't been to the bedside since that thing has come out, but yeah, it's, I can tell you this, it is frustrating as a woman because I think we're now trying to find a reason for autism that's now falls on the mom, like, tell me you hate women without telling me you hate women. But also it's frustrating, I have a kid on the spectrum, and I'm like, I didn't do anything different with him than I didn't my other 2 boys. So it's like this whole causation correlation thing. I don't know what is happening down there. My neighbors to the south. It's a goddamn
It's the
circus down
Wild
there.
West.
Yeah, and I now heard that circumcisions are also a reason for autism. Like I don't understand
Heard that
as a
yesterday.
parent
Yeah.
of a kid on the spectrum why we are trying to find a fault and a cause for something. Like my autistic guy is beautiful. He is like don't tell anybody else. He's like my favorite kid. Like don't tell the other 3. He's incredible, and I'm like to find a reason that he is who he is to me is like mind blowing. So it's wild, and then it's frustrating from a standpoint of like Tylenol is the only medication that women can take for pain in pregnancy. So now you have women like toughing out. I saw him. You're supposed to tough out a fever or whatever it is. Like you have women toughing out a fever, which in and of itself can be very detrimental to a pregnancy and an unborn child to just like sit through a high fever for days and days. Like we have seen, the negative outcomes of that as well. And so now you have these women who feel like they can't take anything without worrying about harming their child because it's obviously them that's, hurting their baby. Like it's an entirely frustrating situation. And I am scared for the next 3+ years. I'm frightened.
Yeah, the part that's hard for me in the whole Tylenol autism discussion is like
Mhm.
unless you have a concrete answer. Now that what
Correct.
Donald Trump and RFK put out is very headline grabbing, very
Mhm.
like this is it. And then when you see what the FDA actually put out, they said that Tylenol is actually the safest safest
Mhm.
pain treatment out there. But that didn't catch any news headlines. They did say there's like a slightly increased risk or whatever it is, but they said this
Yeah.
is the only real pain med you can take and that kind of thing. And for me, the hard part is, and I think this is why it's important for you and me and other people to be out here to kind of shift through the headline grabbing
Mm.
articles that, hey, listen, like the idea here is that this is not the cause. This is not the autism is very
Sole
multifactorial,
cause, yeah.
complicated. It's like genetic. It's what you eat, ultra processed stuff. There's
Mhm.
all these different like adding things into it. This is not the thing. This is just to let you know that, you know, Tylenol might or might not. It's a little bit of information for you, but
Mhm.
that's all it is. It's not like don't take Tylenol. Don't the way that Trump talked about it was
My
like
goodness.
take acetaminophen or whatever it was, tough it out. And it's like, no, that's not the reason why why
Yes.
they put this out. They're just bringing a little bit of like light maybe to
Mhm.
situations that are like, oh, if you have something that's maybe like a muscle strain or whatnot, and it's not
Mm.
life and death type of pain that maybe you can skip Tylenol. But if you have a fever where it's like 105 and you're at risk for having a seizure or early term abortion or whatever it is, then yeah, you have to take the Tylenol. And so that part I think gets lost in a lot of the one side versus the other. And a lot of social media people on the right
My
grab those
gosh.
headlines and are like, it's Tylenol, it's Johnson, this is it. And it's like,
Yeah.
guys, come on, you're gonna hurt people by
Yep.
telling them not to take this. Somebody's gonna die of a fever, someone's gonna have a
Mhm.
seizure out there,
Someone's
someone's gonna
baby
lose
is
their
going to die of a
yeah,
fever, and
someone's
I'm
gonna
telling
lose
you,
their
I'd certainly rather have an autistic child than a dead baby.
yeah.
Plain and simple. And I think that's the big problem with social media is that those sensationalized headlines, they just I mean, it just spreads like wildfire. And then you have like the solid, smart information and it's like, wah, wah, it gets like 100 views. And you're like, well, like, do I got to make up some bullshit, like, sensationalized title and be like, just kidding. Now that I have your attention, please listen to what I have to say. Like, it's really unfortunate. And I think sadly now, even this is much like the vaccines cause autism thing, like, you have one person who sensationalized this, it's been disproven time and time and time again, but that seed was planted, and now it's never gonna go away no matter how hard you try to erase it, and I think this is gonna be the same thing. It's like, we're gonna disprove it, boom, 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 and people will still be like, "Yeah, but Tylenol causes autism," or, "Yeah, but circumcision," and it's like, yeah. Did you see the Dr. Mike when he debated the anti-vaxxers?
I saw his highlights. I didn't watch the whole thing, but I saw what he
Yeah,
posted.
and so it was he just looked at I love the way he debates. Also, Dr. Mike, you're
Yeah.
um, yeah, he basically looked at somebody and was like, "Is there anything that I can say that will make you rethink your way of thinking?" And they were like, "No." And he's like, "Okay." Like, because that's sort of how it is. I always say, like, what I aim for on social media is like, there's this spectrum of people, right? There's the 20% that's like on the extreme this side of that spectrum. There's the 20% that's on, and nothing you say is going to change either side's mind, right? So you got to focus on that 60% in the middle and just sort of hope that you're doing good on that 60% in the middle, because I think that we're never gonna do it for the people on either side of the spectrum.
Yeah.
It's just
I
the way it
I
should be.
actually enjoy conversing with both sides. I'm a
Mhm.
little bit different than the traditional influencer in that sense that I do take a lot of the sometimes there's controversial issues and so I try to break down like where are people coming from and
Mhm.
like the vaccine issue that's always huge and vaccines forever have made life so much safer like our
Mhm.
average life expectancy went from like 40 to 80 or 90 or whatever it is in the last
Mhm.
50 or 60 years. The problem comes when, I think, in my opinion, the government or whatever it is, the CDC or FDA, when COVID happened, there wasn't a lot of transparency, and they did a lot of
Mm,
shunning of people that asked questions, and that kind of lit a fire that it created this like vacuum where it's like, oh, what aren't they telling us? What aren't they telling us? It's Bill
yeah.
Gates, it's this guy, it's that, it's all these like conspiracy, and then it kind of funneled, and then Trump obviously ran with it and monetized it and got elected because of it. This whole like conspiracy the swamp or whatever it is, and so for
Mhm.
me, I'm like, those people. It's not that they are like horrible people or whatever. They're like they think that, but for me, it's like, hey, how can I educate them? That's different. And I'm always like, hey, listen, big corporations, they do have fiduciary duties to make as much money as possible. So
Sure.
let's hold them accountable for what they do and what they do. And then I'm also like, what they have produced has really saved lives because capitalism incentivizes you to put out
Mm,
successful. You can't just fake it till you make it in capitalism. In the biotech, in other realms you can, but not in
nothing
healthcare. And so I'm like, how do I get these people to kind of understand that, hey, yes, vaccines are safe. Vaccines, I have all my vaccines. They are fantastic. They've made lives better for everybody. If you go to foreign countries, you see it. You see
Mhm.
countries that don't have vaccine standards, and you see like the trials and tribulations that kids have there. And so it's very hard to find that middle ground. And I'm appreciative of the way you phrased it because trying to reach the sides is so difficult nowadays because
It's
it's
tough.
so polarized on both sides.
And I mean, point blank, you're just never gonna, you know what I mean? And then, okay, that's okay. Like, all right, carry on, you know what I mean? So carry on.
Yeah. All right. So let's ask you a few questions about you had I went through and put together 3 or 4 questions that are a little bit controversial because I love the controversy. Let's start with the one that I can probably comment on too. You made a video about eating versus not eating during labor and delivery. You
Sure
guys,
did.
tell us what your opinion on it is, and then we'll dive into a little discussion.
Here's my opinion on it, okay? I think that people should do what makes them feel good during their childbirth experience. That's basically what it boils down to. We know that a lot of people don't want to eat during labor because, I mean, you have like this huge amount of pressure in your insides, right? It just, people are not like, I want to eat a Big Mac, usually, right? But if you feel like eating, I think you should have the freedom to do that, provided you know the information. I think it's a bit of a shame that we haven't updated our thoughts in the last, I don't know, since the 1940s on eating and drinking in labor to reflect how far we have come in medicine. I think that that's a real bummer. But I also, yeah, I just feel like we really need to sort of acknowledge that labor, it's like running a marathon. Like we have these people that sometimes stall out in their labor, and I think to myself, like, is it because they haven't eaten, they've been induced for the last 48 hours? Like, what if they had a snack, that Snickers commercial where it's like your mom should have a Snickers? Like, what if that helped? So I just wish that we could update things. I think that providing people with the information on why the recommendation to not eat in labor is there would be really beneficial, because I think people think, if I eat, I'm gonna die. Like, it's like there's like this hard line. So I wish that they knew the percentages and the actual risk, the absolute risk, as opposed to just being like, if you eat, you could throw up in a C-section. And because
What
it's
are
a
the
long line. It's not like you go in to have a baby and you're gonna have a C-section under general anesthetic. Like, that's a journey to get there, right? You gotta like be in labor, something has to be going wrong. You have to go to have a C-section, your epidural or your spinal has to fail, you have to be put under, then you have to aspirate, and the aspiration, like, you have to get it into your lungs, and then you have to get sick, and then you have to die. Like, that's a long journey.
Yeah.
But
What is the
some people take
recommendation
it.
in Canada? Is it how many
It's the
like
same.
what's the NPO?
It's mostly the same. I can only speak to, like, I haven't actually looked up Canadian, like, what their stance is, but I mean, I can tell you at my site, very much so. It's like, if you are induced, we always say, like, eat before you come in because you can't eat while you're being induced. And yeah, it's like clear fluids. And I'm like, oh boy. Also, I think more people need to know more options other than ginger ale for clear fluids. Like, this could be like gummy, but if you can see through it, it's a clear lollipops, gummy bears, like Jolly like, you could do more anyway,
Yeah.
but yeah, it's
It's
basically same.
it's interesting to me when I was training. So as an anesthesiologist, I've done a fair number of crash C-sections where you don't even
Yeah.
have time to dwell
No,
up the epidural.
no.
No, no, I think a part of the guidelines that were created. So there is, we're taught as anesthesiologists that a pregnant female, when they're intubated, it is harder than the average. And I've seen that. I've seen it, and it's
Yes.
mostly due to edematous tissue, also due to the fact that they could,
Yep.
aspirate or throw up essentially.
Yep.
But I think a lot of those guidelines were put into place when we really didn't have video laryngoscopes or those kind of things. And intubation has gotten,
Tubed, like,
yeah,
stuffed tubes,
yeah,
so
exact cup tubes. And I think intubation has gotten significantly easier in the past
I would hope so.
5 years. Yeah, 5 years, 10 years, whatever it is.
Especially since the 1940s, I would think it's gotten a lot better.
Yep, yep. So I tend to agree with what you say. Like I was at a site where they allowed eating during labor, and this was I can't remember which location it was, but one of the hospitals that I was at, they allowed clear liquids and like light snacks, not like
Yes, like,
heavy
yeah.
snacks,
No one's
obviously,
eating a
but like
steak and
Jello,
yeah,
yeah, like Jello or whatever, like things like that that were. But they
nuts.
allowed it, and I personally, and this I can only speak from personal experience, but I did not see, at least in my cases that I did, any sort of aspiration or anything like. Were there a few difficult, intubations? Yes, but even then, there was no aspiration, and so that part of me, tends to agree with you. Now, I don't know what the Canadian standards are, I didn't really brush up on that before I came, but I do think there is a little bit of a merit to that, thought process that, hey, yeah, it is as long as you know the risks, if you're aware of the risks, you can do anything, you know what I mean? Like, we intubate people all the time that have eaten breakfast, 30 minutes before and, in emergency scenarios, and it's not a big deal. So, as long as you know the risks, I think that's a huge thing. Now, I wanna ask you another question about you had a video about TMI, and I really love this video where, you were talking about things that happen during pregnancy that are embarrassing to most
Mhm.
people, and moms per se are especially first time moms are like, I don't want
Oh my
to,
god.
give off a bad impression about what's happening. What are your thoughts on, today's day and age, and I'm gonna pose it a little differently than what you presented in the video. Today's day and age with the next generation of kids, Gen Zers that are coming up, what kind of, advice do you have for them when it comes to their birthing process, what to be afraid of, and what not to be afraid of? Because you and I both know they are a little bit more, I guess,
Mhm.
out and about with their thoughts and ideas as opposed to our generation. So do you have any advice for them when it comes to these type of issues? The audience that's watching, I'm talking about, any sort of like stool that comes out or those kind of things in the birthing process.
Poop, it's the poop. People care about the poop. I think this is where social media is really, really cool and that we can start to normalize some of these things. I mean, I think the up and coming generations are doing a wonderful job of just being like, we don't need to be aesthetically perfect. Like, let's just be real about it. It's not the vibes. It's not the vibes.
Yeah, vibes. I
So
love the
yeah,
vibe. Vibe stuff is so cool
oh
to me.
my god, it's not the vibes. Yeah, so I think people need to know that, like, these things happen and they're totally normal, and, like, I think this is also where, like, if you mesh with, like, your personality that is helping you to have a baby, like, I will if that happens, somebody like, farting is another one, like, you get an epidural, it's happening. If there's gas, it's coming out. You cannot clench that in to save your life, right? And so I'll be like, "Oh, goodness, excuse me." So, like, I think it's really important to sort of vibe it off.
Yeah.
I hope, and I mean, I get it. We could talk about it till we're blue in the face, but, like, really, like, taking a poop in front of a room full of people is never high on anybody's priority list, and it's not enjoyable, but I hope that we can get to a point where we're like, it's a great thing, it means you're moving in the right direction, like, it's not even a thing, like, let's not even have it be a thing, so, yeah. I think that those will always be up there regardless of whatever generation you come from. Yeah, even the what is it? What's next after millennials, Gen Z, Alpha? I mean, they're still
Yeah.
not gonna wanna do any of that stuff in the
Yeah.
delivery room either, right? It'll be interesting to
Yeah.
see how it does go, though.
Yeah. I got a couple quick questions about you and your personal opinions on a couple things, and then we
Mhm,
can go to the rapid fire section. And I think you had a question for
mhm,
me as well.
mhm.
With the changes in healthcare that are happening now, how do you see AI and other health advances affecting maternal care in the future?
Well, that's gonna be interesting. I'm looking forward to the health conference because I see a lot of it has to do with AI, which will be interesting to learn about. I hope that we can, like, make it more convenient for people to access care utilizing these things. I'm thinking about things like telehealth and that sort of thing. Like, nothing is worse than, like, when you are heavily pregnant, maybe you have other kids, you have a spouse that's working, and then you have to, like, put them all in the car, and then you have to go and you have to sit in the waiting room, and, like, you're trying to entertain your kids so they aren't bothering the other pregnant people. So I am hoping that it can make things more convenient for people where these consults that could be done virtually can be done with, like, less pulling less resources from the floors and people where people are needing it. I imagine like you probably have to like leave what you're doing to do like I don't know if it's the same, but we'll have a consult for anesthesiology or anesthesiologists. Why is your specialty so hard to say, by the way? General
It's hard to spell.
anesthetic. It's I always spell it out and then my computer's like, "Did you mean this?" And I was like, "I did, thank you. Yes." But I mean, I imagine you get pulled away from something that you're doing that's could be very important to do like a consult on somebody to basically just like talk to them about the things that are going on in their life and whether or not an epidural is a great idea or not a good idea. Like that to me, that's something that could very well be handled virtually, possibly by AI, like if we can get it to be the right thing. It'll be interesting though, like I wonder about liability and stuff like that with AI.
Yeah. My thoughts are that, right now the numbers they're tossing around for AI, it's like trillions of dollars. The liability side, a lot of people worry about the liability, like who's going to take liability for the radiologist? I'm like, it's a rounding error for a lot of these companies and hospitals in the near future. It's going to be super, I guess, cost effective for the hospital just to pass that off to whatever agency, company, whatever it is.
Mhm.
That's what my opinion is. We'll see how it kind of fizzle or where the ball goes. But it's very interesting. Yeah, you're 100% right. A lot of the education is going to be AI. And I would be interested to see if there's any sort of AI tech that would help kind of predict if you're going to have decels or if you're going to be a troublesome,
Mm.
natural
Ooh.
birth, or just based on your anatomy. If they 3D model your uterus and they're like, hey, this baby is like facing this way and your uterus is facing this way. And like if they're going to come out,
Yeah.
they're going to bump. And this part of the labor process when you're between 7 and 9 centimeters dilated is going to be the hardest or whatever. It's like thoughts like that I think would
Mhm.
be very interesting because it brings another realm of data into the birthing process, which has been around since I guess forever. So that'll be
Yeah,
interesting on my
and
end.
that will be interesting too, because a lot of times, like a lot of the a big hot topic on social media is like a big baby and whether or not you need a C-section because you have a
Yeah.
big baby. Because I mean, you
Yeah.
can't like, we know our ultrasounds can be off. I don't understand how we still have ultrasounds that can be off by such large poundage, but I wonder if yeah, if that'll be a better indicator. It'll be like, this is what your baby's doing. This is what your pelvis is doing, right? Because I mean, you can have a big baby and you can still have them vaginally. It just, I mean, it's not just dependent on the baby's size. There's so many factors, right? So that's interesting. Yeah. Yeah, I wonder though if anybody will actually have to be trained to do anything one day in the future, like 50 years from now. It'll be like, yeah, no, we don't need doctors. We just have
We
AI.
don't need anybody anymore. Just live life. There's
It'll
no
be
more
like that movie
everything is
Wally,
done by
like the Wally movie where everyone just floats around,
as long as it's not Terminator, that's my biggest fear.
right? Yeah.
It turns into the end of the world when these things become super intelligent. Tina, let me ask you a question personally here. If you could whisper one thing to every pregnant person right now, what would it be?
Prepare. I think preparation can go a really, really long way, not just for childbirth, for postpartum, for breastfeeding, for baby care. I think people put all this emphasis and prep into like their birth plan. And then there's no prep for what happens after. So I think for a lot of people, preparation is overlooked and it can be a really, really positive thing for the whole spectrum of your childcare journey or your childbirth journey.
That's excellent advice. And the last question before rapid fire for me is I think a lot of moms and dads especially don't really know how to, I guess like you said, prepare for the 24, 48, 72 hours after baby is born. Do you have any sort of wisdom or advice for that period? Because I think that gets overlooked. Everybody's like, oh, you had the baby. Awesome. Everything's great. Mom is fine. Baby's fine. Right. That's a text, right? Like
Healthy
six
mom, healthy
times.
baby.
Exactly, and then that next 72 hours when we had our son was such a
Yeah.
whirlwind, and I didn't really
Oh my
have any
gosh.
sort of, like, guiding light or even what to look for, what to think of. Any advice in those moments?
Yeah, you kinda just end up, like, stumbling through, don't you? It's like you're just it's like when you're trying to go to the bathroom without turning the lights on, you're just stumbling through, you're hoping for the best, like, "I hope I make it." Yeah, I do. So, I mean, personal plug, I do have courses. So I have a prenatal course, I have a baby care course, I have a breastfeeding course, and I think it is like, especially if you've never had a baby, you have no idea what to expect. Like, I was an aunt when I had my kids, did not prepare me, not even a little tiny bit. And I think, yeah, even if you have had a baby before, if you have a second baby, it's completely different because now you have a toddler to factor in too, right? So, or like an older kid if you're lucky, if you have time, which I did not. I just had old eggs, and so it was like, let's get them out. So I think that, yeah, I really think that being prepared and sort of aware of what to look at, but like, and people always say like, well, I'm not going to memorize. I don't mean memorize a textbook. I just mean know where you can go quickly to access that information. Like, oh, there's a module on that, right? I can look this up, right? But also a village is super important. And then some people will say, like, well, I don't have family that lives here. And I'm like, it doesn't have to be your family. It can be like your church members. It can be your best friends. It can be I don't even care, the person at Kroger that helped you carry if you're close to them and you trust them and they're going to be helpful, then they can be part of your village. So it becomes really important not to care for the baby, but to care for you and your family and your house. Because for me, things were falling off the rails. Like the house looked like a bomb had gone off. I hadn't cooked, I hadn't showered, which is like whatever. But for some people, myself included, just seeing it happen in your home can give you anxiety while you're already having anxiety about becoming a mom and is breastfeeding going well? Is my baby doing okay? Is that normal? Because there's so many things that are going to come up that you're like, that's not normal. So I think just having people to sort of deal with the things that go on in the sidelines that you don't think about that can start to bother you if they start to pile up, it can be important. I think having a long-term plan is also important. Those 48 hours, especially day 2, that devil's night is like your baby just becomes this demon and you're like, what happened to the quiet baby in the hospital that slept all the time? But I remember my husband, like long term, I think it was maybe by 2 weeks with our first baby, people had stopped coming and bringing food, and we were like looking at each other, and the house was quiet, and my husband was like, well, what are we going to eat? And I was like, I don't know, we're on our own. I don't know. I have no idea. So
Real
it's
life.
like, yeah, what are we gonna do when because I mean, everyone wants to come and see that little squishy baby, but it's like after that first little, influx of people, you're like, "Oh, we're just on our own in this house by ourselves to do it all." So, I think again that is where prep can be really helpful, but also, like, having a long-term plan and being like, "Okay, like, what c like, clearly have the roles identified for you and the people in your family, maybe your spouse, so that you know sort of what to expect of each other when time goes on and you can sort of move forward successfully."
Yeah. Well, awesome. I have a few rapid fire questions if you're okay with that as we're wrapping up. And if you want to just keep them to like a few sentences.
Mhm.
Favorite birth snack for labor?
Nuts. Like nuts you eat, not
Epidural?
nuts. 'Cause it's crunchy, it's exciting.
Oh man, that's a good one. I don't know if I could post that one, but
Both.
epidural, the OB podcast. Epidural, yes or no? Or it depends.
Yes. Yes.
Biggest pregnancy myth that you hate.
Wait. This is hard rapid fire. People are gonna think that I'm like a epidural pusher. For
Okay,
myself, yes.
good. Biggest pregnancy myth you hate.
Man, my gosh, there's so many. That the vitamin K shot is a vaccine.
That's a good one.
Mhm.
Go to humor for a nervous patient during labor.
I like dad jokes for a nervous patient. Who doesn't love a dad
Oh
joke?
yeah, that's the best.
Sometimes, there's gonna be birth trauma, like, sometimes it's going to happen. Maybe
Yeah,
I don't think minimizable is a word. If it was a word,
that's a good
that
word.
would be better. Like,
Exactly.
we can
Yeah,
minimizable.
yeah. Which viral video are you most proud of?
The one about birth trauma.
Advice for nursing newbies.
You don't know it all. And you can learn a lot from the people around you if you just have an open mind.
Yeah. Um, Night shift or day shift
Day shift.
in the OB ward?
Day shift.
Day shift. Why? Why? I'm curious.
You know what? I'm like an afternoon shift kind of girl. We have a shift that's like it's 11:30 in the morning till 7:30 at night. It's an 8-hour shift. It's called a day late. It's my favorite shift in the entire world. It's like I always say like you could do a 10-hour day shift and a 12-hour night shift. A 12-hour day shift is too long. It's just too long. Like it shouldn't be a thing. It really shouldn't. It's like by 5 o'clock I
Yeah.
am like done. Like everyone's done by 5 o'clock. It's too much. So I used to love night shift when I was young. I used to go on a date and then roll into the shift and then sleep all day. Like it was great. As soon as I had kids, it was like night shift was off the table. You just can't sleep. Like it's impossible.
Most
Mhm.
common question you're asked on the OB ward.
How long is this going to take? When will my baby be born? It's like, God damn it, I wish I could tell you that. Damn it. Right? Maybe AI can tell us that. Based on your baby's size, your how you've been doing, right? Maybe. Yeah. Yes, I would. For sure. There's just nothing better. Like, and you know what? Even in you're like rapid fire, stop talking. But even in the sad times on OB, like someone's having a loss, I still find it incredibly rewarding personally and professionally because it's like, again, like when someone's having a great birth, you're there for this super monumental, memory-filled moment, but when someone's having a loss, you're still there for a super monumental memory-making moment. And I think those are the times where you can make some of the biggest difference in somebody's life during what is unarguably, like, the worst moment of their life. And so I always feel really, like, honored to be a part of that. I never forget a lost mom, I never forget her baby's name, like, yeah, so even in those really sad times, I think it's still an incredibly rewarding profession to be in, if maybe even more so.
I actually I second your thoughts. I say that with
Mm.
anesthesia a lot, that most of the time when people come into the hospital, when they come in for surgery, 97% of the time it is not for good things. It's always for
Yeah.
scary things. So and you're in the probably one of the worst days of their lives. You get to make an effort or impact.
Mhm,
So it's that's
mhm,
very cool. Do you
mhm.
have a question for me
I
to
do.
wrap this up? Yeah.
I hear a lot from people who say, there's a couple of things I wanna say. I hear a lot from people who say, "I had an epidural and now I have chronic back pain." Like, what's the lowdown? What's the lowdown? Is that true or false? Myth or fact?
Yeah, I'll give you the lowdown. This is like a question I get all the time, you know. So
I believe it.
it's like 90% a myth. There is a 10%, there's a little bit of truth to it. So the majority of chronic back pain, at least as far as literature goes, is positioning during the birthing process. When you have an epidural in, it is more likely for the mom to be placed in a position where she could potentially be stretching something in a way in her back that shouldn't be stretched, essentially, if you follow my
Mm,
drift, but you're
yeah.
numb, so you don't really feel it till after the epidural wears off. And they believe, or at least the researchers believe, that the majority of the chronic back pain that comes after an epidural has to do with the positioning during labor. And that is that is my thought on it. But there is some literature out there that says if you get a dural puncture during a epidural placement. So when we place the epidural, we place it in a spot right between or right outside of the dura where the spinal cord is. And we try to thread the catheter, which is like a tiny wire, in between that space. And then we blast in a bunch of numbing medicine that kind of coats around the spinal cord, but there's still a layer covering the spinal fluid. Now, if you accidentally poke into the spinal fluid, there is some research or literature to say that there is a higher incidence of chronic back pain after a post-dural puncture headache. So that's when you
Mm,
some moms, when they wake up after an epidural and they put their stand up and they're like, "Oh, I feel dizzy, like my head just doesn't feel right." And that's usually has a result of a post-dural puncture headache. So there's a little bit of truth to that end of it. But if you had a normal epidural placement and there wasn't any sort of like they didn't have to poke you 100 times or something like that, then the majority of the back pain that comes, chronic back pain, has to do with mom really straining super hard when she's pushing. So imagine like squatting heavy weights, but have an epidural to kind of numb any sort of like
mm,
if you get like a little micro tear, if you feel it's like a twinge or whatever, you have lidocaine in your spine, so you don't really feel it, and that's or you feel less of it, and it's not a natural like, oh, I should stop doing that, or oh, that doesn't feel so good, and so. I think, personally speaking, from my experience, I think that's probably where the majority of back pain comes after an epidural placement. But there is some literature to suggest that if you do have a dural puncture, that it could potentially be that.
interesting, very interesting. What do you
Yeah,
say to people? I always get parents, and sometimes it's support people, but, like, I always get moms who are, like, really nervous about the epidural because they think that they're going to be paralyzed. What do you tell the people? What do you say to people to, like, sort of explain the risks in a way that like, not only, like, brings the information on, but, like, sort of maybe places them at a little bit of ease?
Yeah, so that's a really common question that we get too. The area where we place the epidural, there's no spinal cord there. So the spinal cord terminates 2 or 3 levels higher. By terminate, I mean like the major thickness of the spinal cord. Now they do still kind of branch out and go out the sides, but the middle where we tend to place the epidural, there should not be any spinal cord there. There's always a chance you can be paralyzed afterwards, but that has more to do with the medicine going in and affecting the nerves than actual direct injury to the spinal cord because the area where we place it tends to not have any spinal cords there. So a lot's a big fear for a lot of people. And
Huge.
the other thing I always tell moms, especially when they're getting the epidural, that, opening the position that the mom is in is probably the most important part of placing the epidural. It really doesn't have to do with
Amen.
how good the technician is or how good whoever else in the room is or the medicine that we're giving. If you are able to hold still and really open up those backbones, placing an epidural is like slightly harder than placing an IV or slightly harder than
Come on,
placing
give yourself some
spinal
credit. Come
cord.
on. I
Yeah, no,
wouldn't
well,
I wouldn't
there's
wanna
some
do it.
research. It is tough, but put people's mind at ease that if the positioning is perfect, or even not perfect, but even
Yeah.
good, because the
Yeah.
majority of moms, it's tough. Like when you're getting
It's hard.
contractions, it's
Yeah.
impossible to hold still. And we usually only have like a 90-second window between
Mhm.
contractions to get it in or move forward or get it up. And so that part of it is very difficult for the mom as well. But if she can do her best, and I tend to, the OBs get mad at me, but I tend to say, like, if you can get it a little bit early, try to get it a little bit early before your,
Mm.
contractions are like
Well,
the
yeah,
most
before the head
intense.
is, like, coming and they're, like, sitting
Yeah,
on the
and it
baby's
doesn't.
head. Okay.
Exactly, and the risk reward profile there doesn't even make
Yeah.
sense because epidurals take 20 minutes to set up, and,
Yeah.
like, you can't just, like, bolus medicine in
Yeah.
that's gonna fix that pain that you're having right at the end of
And they have
childbirth,
locked
like.
empty hair. I can't
Exactly,
feel
yeah, exactly,
my
yeah,
ass.
oh, yeah. So there's parts of it that are hard to explain, but, for me, it's like I understand, like I understand if I was going through the pain of giving childbirth, that's impossible to stay still. But I would say the most important part to avoid, if you're really worried about injury to your nerves or paralysis or those kind of things, the most important pivotal part of it is the positioning. And if you can stay still for the 2 or 3 minutes or not 6, 7 minutes,
Mhm.
whatever it takes to place that epidural. So that's what I would say.
Amazing. I know I always say, like, "Okay, we're contracting." You just listen to my voice.
Yeah.
Like,
Yeah.
you, like, turn into, like, Hypno
Yeah.
Tina, like,
Yeah.
"Okay, you squeeze my fingers, wiggle your like, don't."
Yeah.
But it is really hard, especially if they're really far along, so it's like kudos to those people who wait because we know that well, I always say this is something I would do differently if I had another baby, is that I would still get an epidural, I would just wait a little bit longer because I think the power of gravity and being able to have your feet on the floor is so, so important, and it's often underutilized, but yeah, like, the people that are really, like, almost going into transition and then they're trying like, I'm always like, "You did so" and then they always say, "I'm so s" like, when the epidural is, "I'm so sorry, I didn't do a good job," and I was like, "You did so good," like, so yeah, amazing. That's give yourself some credit, that's a hard job.
And like your viral reel has said, we have seen it all, and we've done epidurals
We really
sideways.
have
I've
seen
done
it all, but
epidurals on the floor.
closing thoughts, if you want an IV place, do call an anesthesiologist, do not call a doctor. Do like a I said to my husband, "When's the last time you put an IV in?" He's like, "Probably med school," and I was like, "Cool, cool."
That's a perfect way to end it. Now,
Amazing.
Tina, thank you so much for joining us. Can you tell everybody where to find you? I'm gonna link it in the show notes below, but tell
Yes,
everybody where we can find you and your courses too, please.
absolutely. So my courses are on my website, which is bumptolatch.com. It's this one right
Amazing
here.
name.
It's so cute, my
Yeah,
baby.
amazing name.
And then I am on social media on the big two, their Instagram, TikTok. I am at mama_nurse_Tina. And then I'm also on YouTube. I love YouTube for long form education. It's probably my favorite platform. And I'm simply Mama Nurse Tina there. So come on over and hang out.
Yeah. For everybody watching, she is probably the best OB content creator on social
Woo!
media right now. Go follow her. She has amazing content. We are in the process. We are trying for our second baby, and I'm going to use all of her content every single day that I
So
can.
good. You're
Thank
gonna
you
buy the
so much.
courses, right? You're gonna buy I'll give
Yes.
you a discount.
I'm gonna buy the course for afterwards because I still don't even know what to do
It's
afterwards. I'm like,
you
oh
know
my
what? I
god.
have 4 kids and I still don't know.
Yeah,
You could throw me you'd be crazy. Yeah.
yeah, yeah. Absolutely. I need guidance. I need guidance in that
Mhm.
moment. So, thank you so much, Tina, for
Thank you so
joining us,
much.
and thank you guys for watching. If you can, please like, share, subscribe, do all the fun things, and we'll see you guys on the next one.